Minnesota Governor Tim Pawlenty is emerging as some would say a calmer, more measured voice on this issue. He says Americans are becoming, quote, ticked off and scared by some of these plans now on the table, and that he has a more common sense approach, and he believes that needs to be brought to such a complex issue. Minnesota Governor Tim Pawlenty joins us now. Governor, welcome. Good to have you on the live desk with us.
Thank you.
Talk to me a little bit. Obviously, this was central to Ted Kennedy's wishes. He really wanted to see a public option plan go through. You feel that we're just getting ourselves into an extraordinary amount of debt on this front, right?
Well, we all agree the healthcare system is broken, but we also have to agree on what the main problem is. For most Americans, it's cost containment, and the program that the president's put on the table not only doesn't contain costs, it exacerbates costs and spending in a way that is concerning not just to conservatives, but also to a broad cross-section of Americans.
You know, when you look at near 9 trillion, I guess, is the latest number that's coming out of the White House, and it's a similar number that CBO put out. $9 trillion over the next decade that the country is going to be in debt. How a lot of people wonder how you can even talk about spending $1 trillion on health care at this point. And, you know, who's going to pick up all of this debt, and where's the country headed if we're willing to take all this on?
You know, that's exactly right. You have an administration and a Congress now that has exponentially grown the national debt. We're going to have the federal government budget and finance equivalent of the home mortgage meltdown because it is out of control, it is reckless, it's not responsible, and the Congress and the president need to hear the message, and that's why you're seeing people get frustrated about it. On the health care side, they also have a government-centric view as to how to fix it. They're saying we're going to have this public option, perhaps. Well, and they're going to say, well, we're going to keep the private sector honest. Well, that means if we don't like the price of potatoes, are we going to have government potato farms? If we don't like the price of toilet paper, are we going to have government Walmarts to compete? That is a very different view than I have and most conservatives have about trying to empower consumers rather than empowering the federal government to take over another program when so many of the ones they already run are in trouble.
Governor, it's Trace Gallagher, and thank you for joining us, sir. You know, we talked in the intro to this how you're the calmer. You're trying to be the voice of reason in this healthcare debate, though you've taken a couple of jabs at Sarah Palin and Mitt Romney for their plan. Sarah Palin on her death panel's comment, and Mitt Romney for his plan in Massachusetts, which you said covered more people but simply does not have a way to pay for those people.
Yeah, I don't think I've taken a jab at them in the sense of criticizing them. I'm just saying the Massachusetts plan has succeeded in expanding access to people who are uninsured, but it has not succeeded in controlling costs. There's another news story out yesterday that in the Boston Globe that Massachusetts has the most expensive and one of the most rapidly rising health care cost systems in the country. I believe Governor Romney, had he been governor these last 4 years, would have done something to address that or fix that. He hasn't been there for 4 years, so I don't criticize him. I think it's a situation where I'm sure he would have done something differently had he been there. He hasn't been there for 4 years.
Is this a turning point for the GOP, this entire health care debate, Governor? Is this, in your mind, a turning point for the Republicans?
Well, I think it's absolutely a turning point and an opportunity because it shows the contrast between the philosophy and kind of government-centric view of the Obama administration and a different way. And if we can be not just critics and chiefs, but also offer a better solution, it's a tremendous opportunity for Republicans. But it's not just this health care plan. Look at the Cash for Clunkers program as an example. We're paying ourselves money to buy clunkers, borrowed from the Chinese, so we can buy cars from companies that we own, so we might be able to pay ourselves back. I mean, that's the Alice in Wonderland quality of the economic policy of this administration, and the American people are figuring it out. They're getting worried and they're getting mad, and that's what you're seeing played out across the country.
Yeah, they are worried and they are mad, and we have seen that. But one of the things that people are saying is that, you know, you see this uprising across the country and some real passion on the part of people who are very concerned about health care, and yet a lot of them seem to feel that they're not getting the leadership in the Republican Party, and they wonder why the Republican Party didn't do something about this when they had the chance. You know, is there one thing that you'd like to see Republicans do right now that would make a difference in this debate in terms of a constructive move?
Yeah, well, absolutely. There's all kinds of things that we could do on even a bipartisan basis, and I know in the time we have, we can't go through it all, but one example of many is we can all agree that we shouldn't pay for just volumes of procedures. We should pay for better health and better health care outcomes. So transforming the payment system from one of volume to one of quality is a point that makes common sense, and it's one that Republicans, but we want consumers in charge of that for them and their families, not the federal government.
Is this going to be a central issue for you as you run for president in 2012?
Well, I haven't said I am running for president in 2012, but it's clearly this is a key issue for all Minnesotans, for all Americans. It's one of the things that is breaking the financial backs of families, small businesses, governments. If we don't solve this health care issue and make progress on it, it's going to drag down the whole country. And so we have to fix it, but we don't like the way that President Obama and the Democrats are trying to fix it by having a government takeover.
All right. Good. Well, I tried, Governor Pawlenty.
Right.
Good to have you here.
All right. The back door into the run for president,
we'll
right?
see you soon, sir. Thank you very much, Governor.
Well, a 21-year-old